Hi, this is Melanie Thomas again, doing my second career profile, and I chose to do it on a licensed clinical social worker. I chose the University of Utah Healthcare outpatient psychotherapy in Salt Lake City, and I don't know anybody in this field. In the work environment, they said that you usually work Monday through Friday, and the hours usually vary. Then the University of Utah Healthcare is a pretty good sized organization. The stressors are pretty high. One website I looked at, a lady had said that for clinical social worker that it is sometimes heartbreaking and emotionally draining. I didn't see anything about the types of benefits that they receive. Some of the tasks that they do, it said that you could do ample research, and they said that there are usually mounds of paperwork to do. You can diagnose and treat mental, behavioral, or emotional disorders that can be related to substance abuse, past trauma, or mental illness. You could also develop and implement individualized treatment approach to meet the needs of each patient and their families. Some of them work with medical doctors, and they need to identify appropriate outside resources to assist patients with resuming life in their own community. All clinical social workers are required to have a master's degree. And then one website I looked at said that they encourage their employees to study biology and chemistry because the employees deal with a lot of people that use drugs, and so knowing the chemistry and how that will work, because it's not just a few drugs here and there, like they mix drugs and deal with illegal drugs. So knowing kind of the chemistry behind the drugs will help know how to help that person. Starting out salary, there was a couple different numbers, but it's around $40,000 per year, and for experienced, it's around $70,000. There's a lot of different places that clinical social workers can work at. They work in health facilities, medical hospitals, psychiatric hospitals, community health centers, mental health facilities, veteran care centers, schools, homeless shelters, children's homes, rehab centers, detention centers, and nonprofit groups. And then also it said to become a licensed clinical worker, you have to acquire approximately 3,000 hours or about 2 years of supervised clinical experience, and then you have to pass an exam. And they also said to learn to comfort people and communicate well with others, because you will be dealing with a lot of people that have very challenging things happen in their lives, and it's important to know how to comfort them and deal with them. So that is my